Do not record.
All right, so I see we have some people joining us. Hello, everybody. Welcome. My name is Lee Johnson. I'm one of the research coordinators at NYU's Grossman School of Medicine. I work within the Integrating Special Populations Core at our Clinical and Translational Science Research Institution. We thank you so much for joining us today. We will be talking about COVID-19. Our webinar will be hopefully super informative for all of you, and we'll answer any lingering questions. We have joining us today Dr. Marilyn Fraser with the Ashe Institute for Urban Health. We have Dr. Joseph Ravenell and Dr. Aisha Langford, also with the School of Medicine at NYU. So we thank you all so much for joining us. We also have my colleague Stu Fuentes, who will be working in the background to help us with the logistics. And so for those of you who have joined us and those of you who are watching via Facebook, this is going to be a webinar-based interactive conversation we'll be having today. So feel free to throw any questions that you may have into our chats. I will be monitoring those questions as we go forth today. So we have a brief hour where we'll be talking about any pressing concerns that we currently have about the vaccine rollout. Um, we're going to have a short presentation. And after I finish the introductions, we're going to do some housekeeping and then get straight into it. So our presentation is going to be about 20 minutes long today. And we have opened the floor for about the remaining 30 minutes for questions. And then we have a short poll that we would like to ask you all just to get a feel for any of the pressing concerns that you may have where you are located, things that we would like to know on our end as researchers. So without further ado, I'm going to pull up our PowerPoint and we're going to go ahead and get started. I hope you all are doing well. Like I said before, this is a webinar-based format. So you will see our presenters and myself plastered on the screen, and everybody I think is currently muted by default. So um, again, if you have any questions, feel free to throw them up on our Facebook Live. We will be answering those questions as we get closer to our question and answer session. And again, thank you so much for coming. We really do appreciate you all taking the initiative to stay informed and wanting to know more from leaders within our community. So we're going to pull up this PowerPoint. Bear with us. I hope you all can see this. We're going to get started. Alrighty. So some brief introductions. Give me one moment. We have Dr. Fraser here today. I'll pull up her bio. She's going to be our moderator. Oh, one moment. All right, here we go. Okay, what is everybody seeing? Hopefully the PowerPoint, yes? Can I get some nods? Haha, fantastic. Thank you for that. Okay, so um, Dr. Marilyn Fraser is the CEO at the Arthur Ashe Institute for Urban Health. She is a research associate professor in the Department of Medicine at the SUNY Downstate Medical Center and the co-director of the Brooklyn Health Disparity Center. She also served as the deputy director and associate director for research and training, where she managed the Institute's community outreach and research programs, such as the Black Pearls and different Fades of Health programs, which prepared hairstylists and barbers to educate their clients about various health topics. She also conducted the Institute's Access Project to increase access to health and social services for formerly incarcerated individuals in Brooklyn. Dr. Fraser has received numerous awards, including the Health Award from the New York State Association of Black and Puerto Rican Legislators. She was also the recipient of the Innovator Award from the Bed-Stuy Family Health Center and the Community Health Award from the Nurses Association of the Counties of Long Island, as well as an Extraordinary Woman of Downstate recognition. She was also nominated to serve on the nationally acclaimed Clinical and Translational Science Award Community Engagement Domain Task Force. Most recently, Dr. Fraser was honored as a Power Woman in Brooklyn and received the Special Health Award. She was also honored as the Woman of the Crane's Heritage Healthcare Leadership Award and named one of Crane's notable women in healthcare. So without further ado, I'm going to turn it over to our moderator for this afternoon, Dr. Marilyn Fraser.
Thank you so much for that introduction. It's my pleasure to be here this afternoon and to talk about something that's really important to all of us, the COVID vaccine and COVID-19 and all that has been going on with the pandemic. And today we have some of the experts in our field and some of the folks within the community and that have extensive community engagement that we wanted to bring to you today so that they can talk about this. And we want to have a conversation really, so it's not much of just presenting to you, but we really would like to have a conversation. And I would like to introduce you to two of my colleagues that will be participating in this conversation and guiding us throughout this afternoon. The first person I would like to introduce you to is Dr. Aisha Langford, and she's someone that I've had the opportunity to work with closely. She's an assistant professor in the Department of Population Health at NYU Langone Health Systems. And she studied a lot in terms of communication, decision-making across health conditions. So this is really important for us as we sit and have this discussion. And she's done a lot of work with cancer screening, blood pressure management, vaccination, clinical trial participation, as well as being a research and a phase 1 clinical trial participant for Pfizer's COVID-19 vaccine. And we'll hear a little bit more about that as she speaks to us. She has earned her bachelor's in English from the University of Virginia, her master's in public health in behavioral science from St. Louis University, and her PhD in health behavior and health education from the University of Michigan. So I would like you to welcome Dr. Aisha Langford today.
Thank you.
And Dr. Joe Ravenell and I go way back, and Dr. Joseph Ravenell is at NYU and NYU School of Medicine's Associate Dean for Diversity Affairs and Inclusion, and he's also the Director of Diversity Research for NYU School of Medicine Cancer Institute. He's a principal investigator for a project to test community-based strategies. And in this, I've worked closely with Dr. Ravenell to go out into to barbershops and actually train and educate men about hypertension and colorectal cancer. And the project has led to a community-based research network of over 200 community-based sites, including churches, including barbershops, mosques, soup kitchens, you name it. And these have been done throughout New York City. And he's also done a barbershop-based video intervention to improve organ donation registration in minority populations. And as a result of his extensive experience with community-based approaches to cancer prevention in minority populations, he was actually appointed as the founding director for NYU Center for Elimination of Cancer Disparities. Something else about Dr. Joe Ravenell, he has been instrumental, and he is in doing a lot of work within barbershops, empowering barbers to do some of the work within our communities. And he's given a great TED Talk. So if you get an opportunity to do that, please view that. So without further ado, I would like to introduce you to Dr. Joseph Ravenell.
Thank you, Dr. Fraser. It's been a pleasure working with you throughout the years, and looking forward to being on this panel with you today.
Thank you so much. I know there's some ground rules I think we are going to cover next.
Yes, my apologies. Sorry, I'm pressing a bunch of buttons. First of all, like I said before, we are in a web-based format, webinar-based format. So all participants, we ask that you please continue to keep yourselves muted. Keep your hands and feet inside the vehicle at all times. No, I'm kidding. We are grateful so much again for you all being here. We are going to continue with our slideshow presentation. There will be a poll and it will come up on both ends. We have a red cap based survey for those that are on Facebook Live. And then for those of us who are, or for those who are joining us via Zoom, it will come up here. And I think there will be a poll that you are allowed to answer the questions as they come up. At the very end, there should be a poll button if I'm not mistaken. So I will turn it back over to Dr. Fraser. If we have any further logistic questions, I will be here, Sonia will be here. So thank you all again for joining us, and we'll go ahead and get started with our presentation. Dr. Fraser.
Thank you, and I'll turn it over to my esteemed colleagues as they give you this presentation followed by our discussion. And again, we want to make this as interactive as possible.
Okay, so Dr. Ravenell and I will tag team this, but I'm going to start off. And first, I wanted to say thank you for hosting this forum, and thank you to everyone who's joining in. As you all know, this has been a pretty crazy past 12 months and counting. It's been challenging being in a pandemic. It's been frustrating. It's been confusing. I think everyone is just really exhausted. Then layer on top social unrest, layer on top politics, it's just a lot going on. So I just want to acknowledge the time that we're in, and also to just acknowledge, broadly speaking, for folks that have been concerned about the vaccines or on the fence or what we call vaccine hesitant. It's quite normal because a lot of the communication has been very confusing, and I totally understand why people are hesitant. I wanted to start off saying my own brother called me a couple weeks ago saying that he was going to only get his vaccine if when he walked in there, they would offer him Pfizer. So he called me at like 11:30 at night, and he's in California. And I hear my mom in the background saying, "You need to talk to your brother. He's being silly. He's being silly." And I just thought that was so interesting because I've been talking about vaccines literally since last year when I joined the vaccine clinical trial. So to have my own brother who like literally my family talks to me all the time to be a little bit concerned. He did get his first vaccine dose, which I was really proud of him for doing. But anyways, everyone has their own degree of comfort. And so I just want to acknowledge that. So one of the things that we hear quite a bit is how in the world were these vaccines developed so fast? And I want to stress that science was not cut. Two of the main reasons that we were able to get these COVID-19 vaccines so quickly. One, maybe for the first time in history, you had the whole world working together and top scientists literally working together, sharing information and studying this really important issue of how to get a vaccine. So you had a lot of people around the world at the same time working together. And you also had sufficient funding, almost unlimited funding, to find a suitable vaccine or series of vaccines. And so when I think about my personal life or even research, most of the time when I can't do something quickly, it's because I don't have the right people and I don't have enough money. And in this situation, we had the right people and we had sufficient funding, and the science behind the vaccines has been around literally for decades. So it's not like they were creating this, in their backyard yesterday. The mRNA vaccines, which the Moderna and Pfizer vaccines are, that technology has been around since the early 2000s. So we had well over 15 years of good science to build upon. The Moderna and Pfizer vaccines, mRNA technology uses a way to give your cells or your body instructions on how to make the little spike protein. And that's that little red spiky thing when you see the virus. So that's how mRNA vaccines work. The Johnson & Johnson vaccine is actually a viral vector vaccine, and it uses something called an adenovirus, which is a different type of virus, but it also teaches your body how to make and recognize the spike protein. In both cases, neither one of them have live virus. So you have zero chance of getting COVID from the vaccine. So I just wanted to stress the research behind these vaccine platforms has been around. In the case of mRNA, been around since the early 2000s. For the viral vector vaccines, which Johnson & Johnson is, they've been studying those types of vaccines since the 1970s. So there's lots of good data and research for both ways to make the COVID-19 vaccines. Next slide. So these are some other questions, concerns that I've heard as I've been doing these town halls with my colleagues over really since October. One of the questions is, will this affect my fertility? And the short answer is no. There's no evidence to show that for men or women getting the COVID-19 vaccines will affect your fertility. And in fact, the American Society for Reproductive Medicine, which is one of the largest professional organizations to help with fertility issues, they actually had a statement saying there's no reason for anyone trying to conceive to not get the vaccines. And if you have ever tried to have a baby, whether you're a man or a woman, we know that it's really important for you to be as healthy as possible. And so they actually encourage people to be updated with their vaccinations, including COVID, so that your body can be as healthy as possible as you're trying to conceive. With regard to pregnant people, while it is true that people who were pregnant were not included in the clinical trials, there's no reason to believe that there will be any adverse effect on pregnant women. So the American College of Obstetricians and Gynecologists, which is the largest professional organization of obstetricians and gynecologists, also have a statement saying that there's no reason for the vaccines to be withheld from pregnant women. And so if you are pregnant and you're on the fence or have concerns, definitely talk to your healthcare providers about it and make an informed decision, but there's no reason for the vaccines to be withheld. And on the flip side, it is quite dangerous if a woman who is pregnant ends up getting COVID or other severe diseases. So just something to keep in mind. There's also no reason to, or no evidence to show that it's dangerous for women who are breastfeeding to get the COVID-19 vaccines. So again, if you are concerned about it or on the fence, definitely talk to your healthcare team. But both the American College of Obstetrics and Obstetricians and Gynecologists also talk about there's no evidence to show that that's dangerous for women who are breastfeeding. With regard to underlying health conditions, I do think it's important to know that many people who had diabetes, hypertension, controlled HIV, and many, many other health conditions were actually included in the phase 3 trials for the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. So there was a diverse group of people with a diverse group of health conditions. So there's very few instances where someone should not get the vaccine because of a health issue. Now, if you are sick for whatever reason, or if you're undergoing certain like cancer therapies, you definitely want to talk to your healthcare team if there's a specific concern about a underlying health condition. But in general, it is recommended for many people who have underlying health conditions, because again, that puts you at greater risk for having very severe COVID or possibly dying if you do end up getting the disease. So it's encouraged that people with underlying health conditions consider getting vaccinated. With regard to allergies, some people have been asking about, what if I have like an extreme reaction? And for most people, if you have like normal allergies, like I have, like you sneeze in the springtime, those kind of allergies typically aren't a concern. If you are someone who has severe allergies, many people with severe allergies are already aware of it. And for example, if they're at risk for anaphylactic shock, they usually are carrying an EpiPen. That most of those people are already aware. But if you do have severe allergies, you want to talk to whoever is doing the vaccinations, let them know that in advance. Like I said, that's a very small subset of the population. And in general, most of those people know it. There's been very few cases of true extreme reactions to the vaccines. But if that's a concern, you definitely want to tell whoever's doing the vaccination that day. And then in terms of adverse events, many people are very, very concerned that they're going to have an extreme adverse event. So I will say the most common reactions to the vaccines so far have been, soreness in the arm at the injection site, a little bit of tiredness, mild headaches, maybe a low-grade fever. Most of those reactions clear up within a day or two. Most of those are mild, but I think many people are very concerned about it. If you do get the Pfizer or Moderna vaccines, sometimes the reactions can be a little bit more pronounced after the second shot. So I always just tell, like I told my brother when he gets his second shot, don't try to keep that day and the next day a little bit light. You may not want to go out and run a marathon. Make sure that you're well hydrated and well rested, and that can help with some of the symptoms. But in general, many of the reactions have been quite mild. Some of you have heard about the Johnson & Johnson vaccine being on pause, and that was very scary for a lot of people, understandably so. But just in context, at that time, there were 6 people who developed blood clots out of about 7 million people who had been vaccinated. So although that we don't want to dismiss that it's very rare that someone's going to develop a blood clot. So they have lifted the pause. And so if you got the Johnson & Johnson vaccine already, and it's already been past 3 weeks from when you got it, your risk of getting blood clots is very low. If you've gotten the Johnson & Johnson vaccine within the last 3 weeks, or you're anticipating getting it, and you're very concerned about blood clots, which again, it's very low risk. It's a very rare event. Things that you want to look for are like an extreme headache, extreme nausea, pain in your legs. Those are some indicators of blood clots. But again, those are very, very rare events. And the CDC and other organizations have basically said, the benefits of getting the vaccines, even if it's Johnson & Johnson, far outweigh the rare event and low risk of getting blood clots and other severe reactions. And I will say that there is a surveillance system called the Vaccine Adverse Events Reporting System that has been ongoing for many decades. So there is a ongoing way to be following adverse reactions. So it's not like a one and done. People, get these vaccines and the government says, oh, okay, great. There is a system, so we are able to keep updated as if new reactions come up. So there is a national surveillance system. Next slide. Okay, so should you wear a mask after getting the vaccine? So the short answer is yes, but as many of you know, the CDC actually came out with some updated mask guidelines for people who are fully vaccinated. And fully vaccinated means that you are waiting 2 weeks after getting your 2 doses if you got Pfizer or Moderna, or 2 weeks after getting your Johnson & Johnson. So the good news is that if you're fully vaccinated and you are sharing space with other people that are fully vaccinated, inside, you can be unmasked. There also are being flexible on the masking guidelines for being outside. So if you're fully vaccinated, you don't need to necessarily wear a mask outside. And even if you're unvaccinated and you're outside with a small group or people in your household, the transmission rates when you're outside are much, much, much lower than being inside. So there's flexibility there. You should check the CDC website. They're updating it all the time, and it's very clear there. Double masking can add some additional protection. So I always say the best mask will be the one that you will actually wear. So if double masking is going to make you fidget around and be uncomfortable and not wear a mask at all, then just wear one mask. But the guideline is if you choose to double mask for additional protection, you would put a disposable mask on first and then put the cloth mask on top. And you want it to be well fitted. So if you choose to double mask, that's what you would do. And then finally, should we as a country, as a world, be concerned about variants? So yes, it's always concerning when there are new variants, but I think, as maybe Dr. Fraser and Dr. Ravenell can attest to, that viruses change all the time. So just because there's a new variant doesn't necessarily mean that, the world is ending, right? Cold viruses change, flu viruses change, viruses change in general. Some of the new variants are indicating that they are more transmissible and easily more contagious. And so that means that there are potentially more people being sick, but it's not quite clear yet if that translates to necessarily more severe disease or more deaths. But, variants are being identified all the time. So that's another reason why you should actually get vaccinated, because of the vaccines that we do have available under emergency use authorization. Although they're not perfect, there's good evidence that they're helpful even against these variants. So yet another reason to get vaccinated. And next slide. Okay, so I think that's our short presentation, and then we'll go into the poll and audience questions. I don't know if you had anything to add, Dr. Ravenell or Dr. Fraser.
No, not right now. I just want to do the poll questions, and then we'll get into our discussion.
Okay.
So for poll questions, the first question is I would accept the vaccine if it was approved, safe, and effective by the government. And you have a set of choices from completely agree, somewhat disagree, or completely disagree. And then the next question, what are the reasons you would not accept the vaccine? And you have a set of choices there. Either you are afraid to go out to get the vaccine, you do not trust the vaccine as being safe, already had COVID, so don't need the vaccine, not worried about getting COVID, and concerns about side effects from taking the vaccine. You do not believe in taking vaccines. You have allergies and concerns about allergic reactions, religious objection, or other. And you can select multiple answers for that question. And the third, I would accept vaccine if it was recommended by my doctor. And you can completely agree with that, somewhat agree, somewhat disagree, completely disagree with that. And then the fourth question, most of my friends and family would accept the vaccine when it is available. If that's true, if you completely agree with that, somewhat agree, somewhat disagree, or completely disagree, let us know. And the fifth question, how helpful was this COVID-19 vaccine webinar? And that's something, as we get on later on, I think you'll answer that towards the end.
All right, so we're going to give you all about 5 minutes to answer these questions. Feel free to add anything to the chat. In the meantime, we've had a couple people throw some questions up via Facebook and via Zoom. So continue to let us know if you have any further questions. We'll give you time to mull on those for a while. In the meantime, we want to take the time to thank our presenter, Dr. Langford. We appreciate you so much. It was very helpful and helped truly clarify some any misconceptions or concerns that we may have that are community facing. So we thank you so much. And Dr. Fraser for being such an eloquent presenter and moderator. We look forward to working with you all in the future. So we have about 2 minutes left. And then following that, we'll open the floor for questions with our physicians and our researchers, our illustrious panel, and so forth. If you have any logistic questions, you may also put them in the chat. So if you're having an issue completing the poll, or if you have any kind of issues accessing the chat, feel free to let us know. I wish I had like some beautiful elevator music to play in the background. But until then, I'll mute myself so you don't get any heavy breathing sounds.
So only you'll tell us when the chat is, when the poll has been closed and we can move on. Great, thank you.
All right, so for, we have some thank yous. We have some love shown in the chat. We appreciate you all. Wonderful presentation, as Debbie says. We do have one question. Can 13-year-olds take the vaccine? So we're gonna actually, our poll is now closed. We're gonna try and share the results. And then once oh, I'm sorry, go ahead.
So I see from our polls, just from those that voted, a lot of people completely or somewhat agree with accepting the vaccine if it was approved to be safe and effective by the government. Also, the reasons that you would not accept the vaccine, and I think they don't trust the vaccine being safe. That's the highest one, or already had COVID, so we don't need a vaccine. So we'll talk about that a little bit more. Also, concerns about the side effects came out strong on that, and we can discuss that in our later on this afternoon. I would accept the vaccine if it were recommended by my doctor. So a lot of people agree with that, with a doctor's recommendation. They would more than likely take the vaccine. Most of my friends and family would accept the vaccine when it is available. And again, most people, either somewhat agree or completely agree with that. And there's a significant percentage, 20%, that disagree with it as well. And how helpful was this? So most of you said it was either helpful or somewhat helpful, and no one said it was not helpful at all. So we're grateful that you thought of this as being helpful to you. And I just wanted to ask a few questions, Dr. Ravenell. One of the things that we hear so much about, we hear about underlying conditions. And I know Dr. Aisha Langford spoke about that. And so what are some of the things that what are some of those underlying conditions that we really need to pay attention to? And what are some of the things that we can do to ameliorate those conditions or reduce those?
Great question, and I just want to thank Dr. Langford for that wonderful presentation and really answering many questions that I think people had. And so there are some chronic conditions that we know can put people at risk for doing poorly if they do contract COVID. Those things include things like diabetes if it's not well controlled, hypertension if it's not well controlled. From what I've seen, for people who have well controlled hypertension and don't have some of the things that go along with hypertension that include heart disease, heart failure, or end-stage renal disease, or end-stage kidney disease, that having controlled hypertension we no longer think of as a significant risk factor for doing poorly from COVID. But the consequences of poorly controlled hypertension, including end-stage renal disease, are very important for keeping an eye on, because those chronic conditions can put people at higher risk of doing poorly. And we know that those conditions tend to impact Black populations more. And so when it comes to the vaccine, because those groups are at higher risk of doing poorly if they should contract COVID, it really is recommended that those people actually get the vaccine to actually prevent getting COVID, given their risk of having basically a more severe course from it.
Yeah, thank you so much. And a lot of people are also asking about the age groups, right, that should be taking the vaccine. I know we extended the age recently, right, in terms of going younger. Folks are asking about even younger than that. You know, I've seen questions about 13-year-olds. Should they be getting the vaccine, or should we go to children that are under those ages? And if you can speak to that, either one of you, if you can talk to that, that will be helpful.
Yeah, so, this is, COVID and the COVID vaccine. As we have seen, we are learning about both of these phenomena in basically real time. So every minute we're collecting more and more data about the safety of the vaccine for different populations. And so, so the Johnson & Johnson vaccine, I know, is approved down to age 16, and Dr. Langford can correct me if I'm wrong on that. But to my knowledge, we do not, none of the vaccines have been approved for people younger than age 16. I have heard of some studies that are going on to actually look at the safety of the vaccine in folks younger than age 16. And I've heard about promising data, but right now we don't have conclusive data on that, although we are actively learning about that. And I anticipate in the coming year that we will have data in order to be able to make recommendations on that. But currently, we don't have the data. And to my knowledge, I don't think anyone is administering the vaccine to people younger than age 16.
Oh, okay.
Yeah, that's right. So for the Pfizer vaccine, 16-year-olds and 17-year-olds were included in the phase 3 study. So for the Pfizer vaccine, if you're at least 16, the child is available. Well, I guess 16-year-olds are not true children, but those young adults are able to get that vaccine. And as Dr. Ravenell said, there are active clinical trials going on, both for Pfizer and Moderna and other vaccines that are recruiting pediatric populations. So young children, 12, 13, but that's in the clinical trial stage right now. It's not available to the public, because typically how clinical trials work, for safety reasons, you start with adults and then you go younger and younger ages, just to make sure we know how it works. So right now, if you had a 13-year-old or a 5-year-old, you wouldn't be able to walk to a vaccination center and have them be vaccinated. But I'm hoping that we will have those data sometime this summer or early in the fall. And then hopefully, as in the upcoming months, they will be available to a wider group of people. Separately, if you are a parent and you are interested in having your child participate in one of the clinical trial studies for children, there are sites around the country that are doing that. And not everyone wants to do it, but you may be interested. And as I said earlier, I'm actually in the Pfizer phase 1 trial. So we were literally the first people to get the Pfizer vaccine. So they're called first in human studies. I'm still in that study. They'll be following me and other folks until July of 2022. So they're following us for 2 years. And there was actually another question in the chat about boosters. So we don't quite know yet when boosters will be needed or how frequently people will need to get the COVID vaccines, because we're still learning. I actually, as part of the clinical trial, opted to get the optional booster about a month ago. So hopefully my data and other people's data will be helping to contribute to the knowledge of like, how will this be like the flu shot where we get it every year, or how long will the immunity last? We're learning, so we don't quite know yet.
That brings up a great point, Dr. Langford, when you talk about clinical trials, right? In our communities, oftentimes, because of history that we cannot, put away and we cannot ignore, that there's a lot in terms of mistrust with systems and mistrust where that is concerned. What's the importance of participating in clinical trials, and where do you see that in terms of our communities themselves participating in that?
Right. So I will give a disclaimer. I'm very biased because my dissertation was actually on how to enhance minority enrollment into clinical trials. So I'm a little bit biased, but I think that my thoughts for over a decade have been, I never tell anyone what to do, but I think it's very important for racial and ethnic minorities to at least know that clinical trials are an option and that they're actually asked and invited to participate. And a lot of times we talk about Tuskegee, we'll talk about medical mistrust, which is a very real thing. Another very real thing that doesn't get enough play and talked about enough is that a lot of times people just don't know and they're not asked. And because sometimes healthcare providers kind of default to everyone's going to be mistrustful, everybody's afraid, they never bring it up. And then that makes you not have the opportunity to decide for yourself if you want to participate. So I think it's important from really a social justice perspective that if you have a health condition or not, because there are clinical trials that recruit healthy people, you should know what all your options are and be able to make a decision for yourself in consultation with your healthcare provider if you want to. So for example, there are cancer clinical trials. Well, a lot of times cancer patients will want to get their healthcare providers input. But like in my case, I want it to be in the vaccine clinical trial to help mankind, but I also wanted to be one of the first people to get it if it worked. So that was very selfish. So I didn't ask my doctor, I didn't ask my family. I was interviewed for something and someone said, "You didn't even talk to your family about it?" I said, "No, this is, I can make adult decisions. And this was something I wanted to do." But if it was like a different health condition, if I was thinking about doing a clinical trial for like, a brain tumor or something with my heart, maybe I would want to engage other people. So the bottom line is that clinical trials are available and an option for many people. And sometimes people think of clinical trials as only for people who are like really, really sick or close to dying. But as you can see, I'm in a clinical trial for a vaccine. There are clinical trials and research studies that like Dr. Ravenell and other colleagues have been a part of, where it might be helping someone lower their salt intake to better manage their hypertension, or maybe it's an exercise program. So there are prevention trials, diagnostic trials, there's treatment trials. There are even studies that help caregivers and loved ones manage, the stress of taking care of someone who's sick. So there's just a wide variety. So I would just say, know your options and make a decision for yourself.
Thank you so much. Dr. Ravenell, I was thinking about a question that comes up often with the vaccine is that if I've had COVID, right, do I still need to get vaccinated because I have antibodies already? And why do I need extra?
Excellent question. And you're absolutely right, Dr. Fraser. That question comes up a lot. And I have actually talked to infectious disease and COVID experts. I've asked them that very same question. And so we know that in a small number of cases, people can actually get COVID again after having had it once, and after having completely gotten over COVID. And so we believe that that it is important for people to get vaccinated with the vaccine, even if they have had COVID. Now, if you actively have COVID or are still symptomatic from COVID, The recommendations are not to get vaccinated during the kind of acute period when you are sick. There are differing opinions about when you should get the vaccine, if you or how long after you get over COVID, how long after you should get the vaccine. But from what I've heard from several experts, if you are at least 4 weeks out from having no more symptoms from COVID, you are encouraged to get the vaccine. But if you have any questions or concerns, definitely talk to your doctor.
With the vaccine, in terms of thinking about what we know about the vaccine, I know there are certain things we don't know about the vaccine right now, but what do we know in terms of like how the vaccine works? If you could reiterate some of those things that were mentioned earlier, that will be helpful.
Yeah, so Dr. Langford did a great job of summarizing basically what vaccines are generally are basically ways for your body to be sensitized or to become alerted to different infections that your body may see later on. And it basically is a way of preparing your body to essentially fight whatever that disease is once your body sees it for real. And so the way that vaccines work is they basically sensitize or alert your immune cells to what your immune system might see if you are truly infected with COVID. And so, as Dr. Langford said, what's being introduced into your body with vaccines is basically small amounts of material that basically code for a harmless part of the COVID of the COVID virus, something called the spike protein. We know for sure that there is no danger from the spike protein, but the spike protein essentially allows your body to recognize what it would look like if COVID, if you were to be exposed to COVID. And so the Moderna and the Pfizer, they use a genetic message called mRNA, and the Johnson & Johnson uses a genetic message called DNA. Now, it is a modified kind of DNA where there's no risk of it getting into your DNA and changing your DNA in any way. It's essentially just a message to your cells to make this spike protein so that your immune system gets alerted to it, so that if your body sees it later on, it can go into action and protect you from getting infected. And the mRNA versus the DNA, just think of it as, for the mRNA being a Ford that's basically delivering the message to your cells, and the DNA being a Chevy that is delivering the message to your cells. We see them as basically equal messengers, both very effective at alerting your body to what the virus would look like if you were exposed to it.
Thank you so much. And there's so much information out there, and sometimes there's misinformation, right? So how do we get reliable information? How do we know where to go to? Dr. Langford?
Sure. So I was going to say, if you only go to one place, I would recommend going to the cdc.gov because it's updated quite frequently. So I was looking at my notes that I printed out. So I printed out the masking guidelines from like April 19th, but then they just updated the outdoor masking guidelines on April 27th, which was yesterday. So it's updated quite frequently. So the cdc.gov is a really good place to start. If you're interested in health information about other conditions, cdc.gov is still good, but also medlineplus.gov has a lot of good information ranging from diabetes to hypertension to doing Tai Chi to palliative care. There's a lot of good information, and medlineplus.gov is actually run by the National Library of Medicine and vetted and reviewed by librarians. So other things that I like to tell people to think about is who's running the website, right? Who's behind it? Is it a government agency? Is it a health department? Is it a university like University of Michigan or Duke Health System, where you can identify who's actually behind it? You want to look at the About Us section. There should always be an About Us section, and to see if they have an editorial board. You also want to look for advertisements. So you want to make sure that it's not a website that's trying to sell you something. And some sites that are reputable do have advertisements or whatever, but you want to make sure that it's actually labeled. So if it's an advertisement, it should say advertisement or sponsorship. So that should be labeled. And other things that you want to look at are the dates. So if we're talking about COVID-19 information, and the last update was, March 1st, 2020, a lot's happened in over a year. Actually, a lot's happened with COVID in the last 3 weeks. So you always want to be looking at the date to make sure the date is relatively recent. And if a website is asking for your information, for like your email or your address or things like that, or phone number, you also want to make sure that they have a privacy policy that's very clear, that tells you what they're going to do with their information. And I would say, lastly, if something seems too good to be true, so if they say, if you, sign up for this thing and for $15.99, we can sell you this supplement and it's going to take care of all your dating issues and COVID, and it's too good to be true, it probably is. So, don't be buying a whole bunch of random things off the internet. So those are some of my tips.
Thank you so much.
All right, so we have about, I'm sorry, go ahead.
Need to get wrapped up soon. I have two other questions. One is around what you talked about with supplements and things that you hear about, right? That people talk about different things that they should use, and then you don't want to discourage any natural remedies. But what are some of your thoughts about that?
So I will say that vitamins and minerals, we need them for our bodies to function. So that's not necessarily bad. One of the things that was really popping up a lot was like vitamin D in particular. So there's no good evidence that vitamin D by itself will prevent COVID or treat COVID, but vitamin D is good for your bones, and vitamin D does play a role in your immune system. But what you don't want to do is go to like the vitamin store and get like 50 bottles of vitamin D and start popping pills. So the best way to do it would be to have your vitamin D levels actually checked by your healthcare professionals, so that if you are going to supplement with vitamin D, that you're taking safe levels and it won't harm you. But you can also get vitamin D from food or the sun. So vitamin D is not bad, but you just want to make sure you're not overdoing it. And I think a lot of people make the mistake of thinking that just because something is natural, that it's safe, right? But there are many supplements and herbal remedies that can actually interact with over-the-counter medications and prescription medications. So whatever you're thinking about doing or currently doing, you just want to tell your healthcare team, just so that you're doing it in the safest way as possible, or to talk to a pharmacist. A lot of times people don't think of pharmacists as, being as resourceful as they can, but pharmacists know all about supplements, drugs, all kind of things and interactions. So you just don't want to do something that can harm you. So for example, there are some herbal supplements that have been shown to interact with the pill. So if you're taking, if you're on birth control, you typically are on birth control because you're not trying to have a kid, although there's other reasons you could be on birth control. So there's some herbal supplements that can make birth control less effective. There are also some herbal supplements that can impact the effectiveness of HIV medication. So again, we're not telling you not to do things, just whatever you're going to do or thinking about doing, it's good to at least let your healthcare team know, so that you're doing it in the safest way possible and you're not doing something that can actually harm you in the end.
Thank you so much.
Right,
and
so
Dr. Ravenell, I know that we need to finish and wrap up, and thank everyone for their participation. But one last question, and the best succinct answer you can give to herd immunity That will be wonderful.
We are not there.
Weird
And so that's as succinct as I can make it. And from my understanding, we're not even close. And so we really do have to continue to use caution and continue to follow the CDC guidance. The CDC definitely has herd immunity in mind, I believe, as they are making their recommendations that, as Dr. Langford said, are updated constantly. So pay attention to the CDC guidelines, follow them, and know that the pandemic is not over.
Thank you so much. Yes, because I know sometimes when we talk about herd immunity and having a certain level of people that are vaccinated that could protect others, we all have to play our part, right? We all have to make sure that we are doing the things that are necessary to have that done. Lee, I know that you've been giving me the time card over the past couple of minutes, and I just want to take an opportunity to thank each one of you. Thank you, Dr. Joe Ravenell, for being here with us and participating today and being so informative. Dr. Aisha Langford, we thank you for your thought-provoking presentation that shared a lot of information with us today. And I'll turn it back over to Lee Johnson so that she can wrap us up and I just thank everyone for participating. And I just want to say that if you need information, the CDC is there, and we have given you other information. If you need information about those social issues, social determinants of health that we didn't get a chance to talk about, you can always visit the Institute's website at arthurasheinstitute.org, or also visit NYU's website. But Lee, I'll just turn it over to you. Thank you so much.
Absolutely. Thank you for acknowledging my cue cards, but I apologize for interrupting you. So thank you so much. Proper Zoom etiquette, if you will. So we have 2 questions in our chat. Luckily, because you all are such forward-thinking experts, you have answered most of the questions in our chat before we even asked them. But we have one for Dr. Langford and one for Dr. Ravenell. We have about 2 minutes left. So I wanted to just throw these out there. Dr. Ravenell, so we had a question that said, should persons receiving immunosuppressants take the vaccine, and what is being done for people with these health problems to help those conditions, as well as getting the vaccine, or more so than the vaccine?
So if you are immunosuppressed, and particularly if you're taking medications and are immunosuppressed, you absolutely need to talk to your doctor when it comes to getting the vaccine. In some immunosuppressed conditions, we're finding that those people actually do not respond to just two doses of the vaccine, and may actually need a third dose for those for the Pfizer and Moderna. And I don't yet know about the efficacy of an immune response in immunosuppressed people after the J&J vaccine. But we are learning more and more about the vaccine in those populations, but you absolutely need to talk to your doctor if you are being treated for an immunosuppressive condition.
Okay, thank you. All right, and lastly, Dr. Langford, we had someone who wanted to know more about the vaccine in terms of the results in mice first, and then how it transpired in humans.
Okay, so can you email me? I don't have that data right off the top of my head, but there was clinical research done in the lab before it was researched in human beings. So I'll have to find that for you. So I guess I'll just put my email in here. So sorry, I don't have an answer right off the top. No one's asked me about mice before.
That's fine. That was a very cerebral question. So
yes,
I was thinking the same thing.
I can speak to it briefly, and I came across this as I was looking at should people who are pregnant or lactating get the vaccine, and this has been looked at in animal studies, including mice, and to our best knowledge, there at least in pregnant or lactating mice, there have not been adverse consequences noted for those groups. But I'm also happy to look into it more to share with the questioner.
Okay, that's wonderful. Well, luckily, we are right at the mark. We want to thank all of our panelists for joining us today. We want to thank all of you who are viewing today, all of those who participated in our chat or via our Facebook forum. We thank you so much. Any information that we have been given or have given out today, whether it be via the chat or whether it be via presentation, will all be included in our recording. It will be listed on the Arthur Ashe Institute Facebook page, and that's at www.facebook.com/Arthur Ashe Institute. If you do not have any more questions, we would like to adjourn for today. Dr. Langford has included her email address in our chat. So if you have any further questions, feel free to reach out. Dr. Ravenell, if you would do the same, we'd very much appreciate it. And if you have any other logistic questions on how to access today's information, our webinar, or anything else, feel free to reach out to myself or Madam Cifuentes. It is our emails are first.lastnames@nyu-langone.org. And we thank you all so much again for all of your participation. We hope that you all could take today's information and are, more willing and full of understanding when going forth in your vaccination process. So thanks again. Be safe, everyone, and have a great day.
Thank you.
Thank you. Bye-bye, everyone.
Thanks.